All right. Good evening, everyone. So, I was a little rushed getting to set up this whole thing because my wife and I were just at a marriage seminar. It was just an opportunity that was being offered in our area, and we wanted to check it out, learn some good things, and always, be working on our marriage, be working on ourselves to make sure that we are able to serve and care and love for each other as well as we can. So that was a really cool opportunity to be able to do that. But that also means that we had some late nights over, Saturday, Sunday, and then yesterday and today. So, um, yeah, glad to be here though. I know I had hyped the video with Abby Maxwell Hansen a lot, and so I hope that you all have had a chance to watch it in the time that it's been out. And if you haven't, definitely go check it out. One thing that I did realize later on is that her presentation style is a lot different from mine, and so I think maybe cultivating an audience or a community that was really used to how I talk about things, and then suddenly to get hit in the face with her very peppy, very energetic presentation style was probably a little jarring for some people, and they made that known in the comments. And so that was one thing that I was a little disappointed in with the way that a lot of people responded to. I feel like a very surface understanding of just like, oh, she's laughing about the kid's trauma. And I thought that was a very short sighted, kind of narrow approach to understanding like what her presentation was about. And I was able to talk to Abby a little bit later on, as she was seeing some of the comments roll in, and she said that like, that's part of the way that some Mormon communities, some Mormon women are just kind of trained and taught to present themselves, just to be bubbly and smiley all the time. And that actually kind of reinforces her case as like an insider with some of this insight into what it means to be Mormon and what the church teaches. So, I was a little, yeah, I guess disappointed is probably the best word about the response that she got from some of these commenters. Um, Yeah, so that was something that we were talking about behind the scenes a little bit. I didn't think it would be that much of a problem. Like a lot of people were saying, like, they got like 10 minutes in and they couldn't take it anymore and they had to shut it off. So I think that there was a lot of missed opportunity for people to learn if that was what was the barrier for them with her presentation style. But I do get it. Like, not everyone's going to be enamored with how I present things. Not everyone's going to love how Abby presents things, and everyone in between. So that's fine. I just wanted to talk about that a little bit. And I really do think that some of the laughing about stuff too is just like, if you have a comedian who's going to make fun of their own culture or other people's cultures and stuff like that, um, you know, they're going to be making jokes, laughing about things that are serious or potentially be triggering for some people. But the point of that is not to make light of those situations necessary, but to be able to shed light on it and be able to talk about it in a way that can acknowledge that it's ridiculous or that it's hurtful, but in a way that changes the perspective on it. And humor is actually a really helpful way to be able to approach some things around mental health that would otherwise be really challenging. Um, so yeah, Aaliyah, it sounds like you get it. So appreciate you validating what I'm saying here. Um, yes. Other than that, though, we are here for a pretty serious topic, and I'm not going to be, making jokes or making fun of it. But this is meant to be a little more informative, and we're going to be talking about. I forget who commented this on one of the videos. Someone was asking about how someone who might be low income might have access to mental health services. And I was thinking about that question, and it really struck me that for some areas of the world, you have to reach a certain level of privilege and socioeconomic status to be able to access mental health services, which is really antithetical to how we think about mental health being kind of a universal thing or a universal need that only some people might have access to services or might only know of certain ways to access services. And a lot of times the key to the barrier to entry is money. So I wanted to talk through a couple of different ways I could think of to be able to maybe work around the way the healthcare system is set up, to be able to take advantage of resources that maybe don't get enough press, and be able to access mental health resources in maybe some less traditional ways so that everyone who would like it would be able to have mental health help. So I have a love-hate relationship with insurance carriers because they do make my living possible, but it is very challenging for people to navigate, and knowing some of what I do about how deductibles and copays and stuff works, it does get really pricey for people who are paying premiums on top of all the extra added costs that are incurred. So let's talk about that. The first thing I want to be able to talk about, and this is not a paid sponsorship. I'll add as a side note, if you all have watched the video about the Mormon Insider and with Abby Maxwell Hansen, that was our first real sponsorship. So that was very exciting. But what I'm going to link below is not a paid thing. This is just an opportunity that we've been given as part of this platform and this channel that I want to share with you all. So let me link. So Elomia is a mental health AI chatbot, very similar in a vein to Flint, except the difference here is that we're getting free and full access to a demo version of Elomia. I think that's the web version because they're still working on the app right now. But that's full access to an AI therapy chatbot until the end of May of this year. So just as a first step, I know it's not therapy, I know it's not a therapist, but if you're short on resources and you need some kind of tool to either walk you through some CBT exercises or to just be able to listen and maybe use it as kind of like a responsive journal, that could be a stepping stone or a stopgap if you're needing mental health support. So I wanted to throw that out there right at the beginning. Again, that's not paid, but it's just an opportunity that we've been given as this channel, and I want to share that with you all. CBTI. I actually, I don't know much about what it's been coded with. CBT for insomnia. Okay, thank you for clarifying, Aaliyah. I don't know. I didn't ask too much about what it was coded with. I know they said that CBT was a big part of it, but of course some of it is self-learning as well. I felt like some of that would probably be proprietary on the part of the programmers, so I didn't want to pry too much. But if that's something that would be helpful for you to know, I can definitely send them an email asking. And let me make a note of that, though. And then maybe I can send you a message later on to see what they might be able to tell me. So, so with that, that's one option. And there are other apps as well, like you saw with the Flint app, that was the sponsorship on Abby's video. That one is a paid app, so I think you get 5 free responses from the app before you have to start paying to unlock the full plan. I don't know how much that costs. I probably should, but I don't. As far as I know, the journaling part is free. So you can log your mood and your emotions daily, and with all the different options and stuff. I think that's all free and part of the app. So for kind of like a mental health support tool, absolutely. There are meditation and mindfulness apps, and you can find the one that works best for you. So those are some kind of technological ways to be able to access services. I will say it has been a lot easier to access services and mental health counseling and therapy ever since the pandemic, honestly, that put telemedicine on the map. And so platforms like BetterHelp might offer a cheaper solution for some people if you have like a really high deductible and you'd be paying like $10,000 out of pocket before your insurance starts covering costs, then you'd probably be better served just paying out of pocket for like a telehealth counselor on BetterHelp. And it doesn't have to be BetterHelp too. That's just the most saturated one, I guess. They have the most ads and stuff, so that's the one I know the most about. So that's one option to be able to access services for potentially cheaper than insurance might cost. But when I'm talking about low income clients, I'm not talking about like people in the lowest. Oh, okay. So Aaliyah says that BetterHelp ends up being more expensive than just paying to see a regular therapist. What I might say that it depends on what kind of way you're paying the therapist. If you're paying out of pocket with insurance, what that means is that for some people, if they have a deductible, you have to pay a certain amount completely before insurance starts covering costs, and that can get ridiculous to like $10,000, $20,000 a year, and I can't imagine BetterHelp costing more than that. I don't know for sure because I've never paid for services through BetterHelp. Okay, and so if you just have a copay and not a deductible, then I could see that being cheaper if you're paying like $30 per session for your copay that your insurance covers. That would make more sense, probably. So again, that's where insurances get tricky because you have to actually understand how your plan works to be able to make the best financial decision for yourself to cover your health care. And I'm not an expert on insurance. I just know what I know based on my experience working with them. That's something that hopefully your insurance company can walk you through if you have questions about that. And so like I was saying, when I'm talking about low income clients, I'm not talking about necessarily like the poorest of the poor, because in theory there's there's Medicaid and more of a safety net, and people taking on pro bono clients for people who are within a certain socioeconomic bracket and things like that. What I'm talking about more is targeting people who are kind of in the middle, where they're not like within poverty range, but they're also not like solidly middle class yet. And that's where you get a lot of those insurance coverages where they have to pay for it, but the coverage is not great. Maybe you have a high deductible, and you're paying for a lot out of pocket. And so therapy becomes prohibitively expensive because you have to pay certain thousands of dollars before your insurance will cover anything. And then it's very easy to just decide, okay, therapy's not worth it, and I'll just focus my money and my resources on something else. So those are kind of the people that I'm thinking of when it comes to this topic. So I will say, in crisis situations, you can always call 988, the mental health crisis hotline. They are apparently overworked, as I talked about in a news article a couple months ago. But in theory, there's a chat line, text, and phone line that you can contact 24/7 when you're in crisis. NAMI, the National Alliance on Mental Illness, also runs their own hotline, I believe. And so in crisis situations, you can also potentially walk into a hospital saying that you're having a mental health emergency. And for some hospitals, they can screen you right there and get you connected with a mental health hospital if that's required, that kind of thing. So all that to say, I think the crisis infrastructure is probably the best across all socioeconomic lines. Like, that's the most consistent across socioeconomic lines. what we're talking about where it becomes more challenging is kind of like the marginal cases where you would probably benefit from some regular counseling, but it's also to the point where you can justify not going. And so we'll talk about some of the ways we can access that kind of therapy now. And let me see if I can do this. That's not what I'm looking for. All right, bear with me for a second. I am trying to get the entire window. Maybe that's not going to happen. Okay, let's just go with that. All right, you all won't be able to see me for a second. So, in terms of accessing kind of longer term mental health care outside of the crisis situation, what I've pulled up is the Fairfax County government website. And I'm using Fairfax County as the county that I grew up in. I no longer reside there, but it is a county within the state of Virginia where I work, and this is where I've always worked, so this is where I'm most familiar. In Virginia, there's legislation that says that each region of the state must have a community services board, which is a public mental health agency that will provide crisis care at a minimum, but as it turns out with funding and all of that stuff, they start offering other services. And this is public mental health, so anyone should be able to access these services regardless of their ability to pay. And so what I'm looking for here, okay, so I've never navigated the Fairfax County website before. So it looks pretty nice. I would guess I'm looking at services. Maybe find animal shelter. Okay, mental health support. So this should be able to take me to the community services board. Okay, and I see that CSB there. And for those of you who are not in Virginia, I think most states at least make the effort to have public mental health resources available throughout the state. There might be some more rural areas where you might have to travel farther, but again, with the advent of telehealth, you might be able to still access some mental health services even without being physically near a counselor. And so, okay, we've got some email addresses, a physical address, phone number, counseling, medication, crisis response, and other services for people of all ages with mental health concerns. Let me see if they say anything about, okay, paying for CSB services. What do they say about if you don't have the money to pay? Have a question about your bill. Okay, call them directly. Fees are charged to help pay some of the cost for services. And Aaliyah, to your comment about that website, Fairfax County is one of the wealthiest counties probably in the country. So I do hope that they have a good website. Okay, so they list all of the insurance coverages that they take. That's a lot of them. Medicaid, Medicare, absolutely important for low-income clients. If you have income... Okay, financial assistance and ability to pay. Financial assistance is available on a sliding scale based on the ability to pay scale for some of our services, determined from income and household size. Okay, so they're going to try to charge your insurance first. Does not, okay, and you're not going to get a discount on some of the stuff that you have to pay for your insurance. Yeah, okay, so this is really key here. Are not eligible for Medicaid. That means your income is just high enough that it's outside of the Medicaid threshold, but also means that you don't necessarily have that much discretionary spending income or just extra money lying around to be able to pay for counseling. So let's look at this ability to pay scale, see what they say there. Oh, okay, this is gonna Let me see if I can understand this. And okay. Percent of federal poverty levels. Oh, okay. I see how this works. So there's a federal poverty level that's put out by the government, and so, man, this is confusing. I would hate this if I had to use it. But basically, if your income, your annual income, is a certain percentage, let's say 200% of the federal poverty level, which, oh man. Oh, okay. So this is for family members. Okay, I got it. So if I make, let's say, $35,000 a year, that puts me in the 200% federal poverty level. And if I have two people in my family, right, I guess I'd be like myself and a spouse. If I make $35,000, that means I am only responsible to pay 20% of the service fee for the CSB. That's assuming like there's nothing that's covered by insurance or nothing like that. But so that's how that chart kind of works. Let me swap back here. So that's a quick explanation for like why CSBs might be helpful, because they are designed to provide services for anyone within that locality. And that is something that you need to be careful of. At least in Virginia, when I worked at the CSB, then we had to make sure that anyone who came into the office was actually a resident of that area, or else we could not see them. We had to refer them over to their regional CSB, even if, physically our office might have been closer. But so that is always an option for, people who live in states that have those public mental health services available. Another option is to go for nonprofits. There are a bunch in the area that, at least in this area, there's a bunch. And so again, with more rural areas, maybe areas where mental health was not as much a priority, whether government funding wise or just local funding wise, that might be less of an option. But again, if you contact your CSB or the analog that you have of a CSB, then they should at least have like a referral list or a list of local nonprofits that maybe, so in our area, we have a specifically substance abuse for teenagers, young adults, and their families nonprofit. And so for a lot of the cases that we had at the CSB that kind of hit those areas, we would refer them to that agency if they felt like that would fit their situation better. So usually like the CSB or whatever is similar in your area would be the place to start. And NAMI, I believe, also has a list of nonprofits. I'm going to go on their website really quickly because they also are worth looking at. And Aaliyah, yes, you are absolutely right. When we're talking about literacy, this is not easy to decode. I can because like I'm used to reading stuff like this, but not necessarily for everybody. All right, so this is NAMI, the National Alliance on Mental Illness. And let me see if I can find... Okay, so NAMI has support groups nationwide, I believe. So let me see if I can... There's a family support group, NAMI Connection. And so I will say a lot of this is predicated on access to technology, which again is not something that I would necessarily assume for everybody. But, maybe at a local library or at least on a phone, maybe you might be able to access some of this stuff. Okay, local NAMI affiliate to find a support group. What do these green and blues mean? Maybe that's just to differentiate states. Okay. Let me try... a Fairfax County zip code, 22032. That was where my first house that I grew up in was. NAMI, Northern Virginia. Okay. And then details. And then I can find info, website, where they serve, and where all of their groups meet, and what times and what dates. So they have family support groups, NAMI Connection. Oh, that's held on Zoom. Interesting. Okay, so Leah, you said there's a there was building of social workers in each city where anyone could walk in to get support and be referred to the right agency, community, org, etc. Oh, yeah, that's a good point. Okay, Aaliyah, thanks for bringing that up. So within the CSBs, at least in Virginia, I'm only speaking from experience in my time in Virginia, you can also get case management, and those are the people who, they're not social workers, but they are kind of like mental health professionals who their job is to get you connected with the resources, to be able to make the referrals, get the funding, all of that stuff, and to walk you through the process of getting access to the services that you're looking for. Let me try to find something with a more rural. Aaliyah, do you happen to know any zip codes around you that might be less urban? Because I know the Northern Virginia one, and that is not a great example for someone who might live in, the middle of nowhere, Tennessee. So if you happen to know zip code off the top of your head, or can look one up for a rural area, I'm going to be looking one up right now too. Probably, let's try, rural counties, Virginia. Most rural counties in Virginia. Let's see. Page County. Okay, let's look at Page County. See what NAMI can do there. Okay, let me try Aaliyah's too. 97005. Glad you knew that off the top of your head. You had to do a lot less work than I did. Okay. You all have two NAMIs there. NAMI Clackamas and NAMI of Washington County, Oregon. Interesting. I don't know which one would actually be closer. But let's look at what we got here. We've got, looks like a specific worker's email address. Website. Yeah, multiple connection, one family support groups. Yeah, that's pretty cool. All right, let's try this one. Lapine 97739. Go back. That was okay. This is actually really fascinating for me to see. Oh, you might have beaten the system here. What if we branch it out a little bit to 25 miles? Okay. You might have found a dead zone there. Central Oregon, Douglas County, Lane County. So I don't know how close those are, but it looks like that's a bit of a stretch. Yeah, apparently. But again, this is having the online options helps. So this is an option to have like support groups, again, not fully therapy, but there's some access to services and being able to at least speak with people who are in that world, in that realm, and be able to share and get support. The last option I'll talk about is, this is more kind of location dependent, but if you're near a university that has a counseling program, a lot of them have programs on campus that would offer their students opportunities to practice their counseling. So when I was in school, we had both, we had a local family counseling clinic where the marriage and family therapy students could provide therapy for families who were in the public school system. And so they would get referrals for low income families, people who couldn't afford therapy, and this would be their opportunity to get experience, get supervision in their work, while also being able to serve otherwise underserved families in the area. We also had an addiction clinic. That was more for students at the university, but every college is going to do things differently. And so the way that they engage with the community and serve the community and also provide their students with experience, that is potentially one way to access services for cheap or free. Interns as well will be interspersed throughout the country, just wherever they end up and are trying to work to move towards getting a license. So this is someone who has completed their schooling, they've graduated, they have the degree, and they are just getting hours under supervision. And that's helpful because that someone who is licensed is overseeing their work and providing kind of a check and balance on the work that they're doing. But these interns now recently, at least in Virginia, can charge for insurance. And so if you have insurance, they can still see you. And if you pay for a self-pay rate, they would also charge less per session because they don't have the same license. They're not on the same standing as a licensed professional. So those are some ways to kind of, it's not like beating the system, but kind of work around some of the barriers to like just looking up on Google who's a counselor near me, calling them up, and then you find out their self-pay rate is some $100, or your insurance, you have to pay like $5,000, $10,000 out of pocket before insurance will cover anything. So these are some different ways to be able to access services if your income doesn't quite match what it would cost to normally get counseling. So that includes some of the crisis systems. Again, please don't use crisis hotlines as counseling. That's not what that resource is for, and it taxes those systems even more than they already are taxed. But local government, public mental health, hopefully that's an option for most people across the country. NAMI and nonprofits might have free support groups, might have community outreach, prevention efforts, or they might offer like a sliding scale where you might be able to pay less based on how much or how little that you make for their services. And then being able to seek out residents or interns who might be able to offer free or discounted services for counseling while they're under the supervision of somebody else. So this was a little more targeted as a video. So I hope whoever commented that initially was able to watch. Aaliyah, if anyone rereads the chat, it just looks like you're talking to yourself. But you said primary care doctors as well can help refer, find a colleague who could offer suggestion for mental health options. Yeah, absolutely. I do think, at least my impression is that primary care doctors are working more towards kind of a holistic view of health. And so being able to ask for that referral can be a way of accessing services, and maybe their office does have some list of referrals where, like, if they know that you are low income or don't have that much money to be able to pursue counseling, that they might have a list of resources that you might be able to access otherwise. Thank you. My wife cuts my hair, and she's been doing it for a long time, and she's pretty good at it. But yeah, so I just wanted to get that information out there. Again, let me link the sign up for Elomia for those of you who watch this. That can be kind of a mental health resource for you all. I would encourage you not to use it in place of counseling, but as a way to support your mental health, to be able to track things for yourself, to be able to gain some insight and use it as kind of a supplement. So that's free access to the Elomia web demo until the end of May, so until the end of next month. But yeah, thank you all for tuning in, and for anyone who needs this information, please share it with them. I think this is something that doesn't get talked about in mental health so much because it's just like, oh, get counseling, go talk to someone. But sometimes it's not really actually doable for people who don't have the financial means for it. So I hope this is something that's helpful for people to actually be able to access the care that they need. Yeah. So Ren, what I was talking about is that, yeah, there are some families that are like kind of on the lowest socioeconomic end. They are probably going to have Medicaid, but there's also a gap in the middle where some families make just enough to not qualify for Medicaid, or Medicaid covers a lot less of their costs, and but they still don't have enough money to be able to pay for therapy on a regular basis, whether because their insurance they can't afford like the good insurance, or they can't pay enough for premiums to be able to bring their deductible down, and it just ends up being cost prohibitive. And so those are the kind of people that I'm talking to, where they're kind of in the middle, just enough to be able to fall through the gaps of like, I don't think I can afford to go to therapy. I can't afford the extra $100 or so of expense each month. And that puts families in a really hard spot, especially because mental health can affect so many other aspects of your lives. So I hope some of that information was helpful. Like I said, been doing a lot today, so I'm going to wrap this up a little bit early. And yeah, absolutely, social services. A lot of this does come down to what your local government does, and this is where local politics actually makes a really big difference in terms of how they allocate funding towards mental health or any other kind of service. Yeah, maybe we need to do a live video about insurance. I don't know whether that's going to get a lot of hate or not, but I think insurance can be misunderstood, and so I'll consider it. Maybe I can bring on an expert on insurance. But yeah, thank you all so much for tuning in. Like I said, long day for me, so I'm just going to turn in early. But oh yeah, you can hear Kitty too. I'll give you guys some time with Kitty. Oh, he's here. Kitty has just been napping so much recently. But yeah, so thank you all for tuning in. And again, check out the video with Abby Hansen. She makes an amazing presentation about what's going on with the Mormon beliefs and teachings that go into the Ruby Frankie and Jody Hildebrandt case. So definitely check that out, and I will see you all next time.